Welcome to the American Institute of Healthcare Professionals videogram on schizophrenia. This is a short video that is just going to highlight a few key concepts and ideas surrounding the disease, the mental disorder known as schizophrenia. And it will enlighten some individuals to maybe what are some symptoms and what are some ways that this particular mental disorder is treated. Unlike other mental disorders that we've discussed in some of our videos, though, there is no emotional imbalance or personality disorder in this regard, but it is primarily dealing with a distortion of reality. Since it is a psychotic disorder, individuals cannot tell the difference between reality and their own delusions that they are experiencing. Fortunately, it's very rare. Only 1 in 100 individuals suffer from this particular disorder. It's either acute or chronic in some cases. It can set in and then leave, or it can be something that is a consistent problem for the individual, and the individual will need to be on psychotic medications for their entire life, antipsychotic medications. It can either be positive or negative. With positive, there are inappropriate displays of behavior, and with negative, the displays lack what we refer to as an appropriate behavior, a lack of something instead of something being added to, as in the case with positive. Now, an example of these symptoms with positive behaviors, which are inappropriate, would include random laughing, talking to oneself, a disorganized speech, or a change of emotion from sudden sadness to rage to whatever the individual is experiencing. A negative exposure, a negative emotional response would be lacking of appropriate behavior, which would include an individual who's more, as they say, catatonic. They don't respond to anything. They have delayed reactions. They have emotionless faces, and there is not much response to stimuli itself. So there can be a positive, inappropriate response that we see from these types of individuals, or there can be a negative where the lack of appropriate manners are not there, where the individual kind of goes deeper within their own brain, into their own delusion, and they just have a horrible time being able to communicate whatsoever. In many instances, those who display inappropriate behaviors, they display a idea of delusions of grandeur, so to speak, thinking that they are going to do something great that is unattainable, or that they are being persecuted or followed by the FBI or by aliens, or that they're going to be captured by someone. These delusions can produce commands, voices, and visions which they feel compelled to follow in itself. So when you're dealing with these types of individuals, it's obviously extremely dangerous. In fact, in medieval times, many considered these individuals to be possessed, but with modern science, we obviously understand that there is a natural explanation for what is occurring. And what is occurring is issues within the brain. The brain is not functioning normal, obviously. There could be genetic and abnormal brain development. Some have thinning in the cerebral cortex itself. Also, within the thalamus, sensory information is not being properly processed because of its overactivity within that thalamus. Overactive amygdala as well takes place with incoming emotions. So the thalamus is overactive, the amygdala is overactive. There are also irregular brain waves and fewer neural connections than someone who does not have schizophrenia possesses. So it is primarily the cause and root of the problem exists within the brain itself. And those are pretty much the primary causes for an individual to experience these types of visions voices, delusions, distortions of reality itself. Now, there's no cure for schizophrenia, and one cannot go untreated without it. One needs a variety of antipsychotic medications, behavioral cognitive therapies later after one is medicated. Some, in the most severe cases, still require an electroconvulsive therapy, which might seem barbaric, but it's done under sedation to shock the brain into better brain functioning itself. If someone who is only certified as a spiritual counselor, a pastoral counselor, it can be very dangerous communicating with these types of individuals. And it's very important to refer them to a licensed professional who has expertise in this type of psychotic behavior in itself. If one is ever found to be discussing issues with someone who is in acute schizophrenia, you never want to agree with the delusion, but simply ignore what is being said. And if they become hostile, because they can become to the point where they become filled with rage and wish to attack, you would want to discontinue the conversation immediately and call the proper authorities. It's only when they become medicated in which a professional is able to speak with them reasonably and be able to help them. In many cases, they're in and out of mental institutions and hospitals because they need that care. And if they don't receive it, they become a threat to themselves or obviously to others because of the delusions and the voices which they are hearing. We are the American Institute of Healthcare Professionals. We offer a variety of mental health certifications. These types of certifications help licensed professionals have other types of certifications under their belt. We obviously do not offer clinical licensure of any type. Those are issued by the state. And we don't offer any types of certifications in schizophrenia. This is merely just an educational video to introduce you to what the term is and what it embodies. So if you'd like to review some of our mental health certifications in grief, in stress, in anger, in crisis, these are very supplemental types of fields that can add to an already strong existing resume. Our phone number is 330-652-7776, and our email is info@aihcp.org. Thank you for listening and have a good day.